All right, thank you, Lisa. We've got a couple great talks in store for the second plenary session. The first of which is a gentleman by the name of Chris Tanti. He is the CEO of Headspace in Melbourne, Australia, and his talk is called Headspace, an Innovative Approach. And he'll be talking about how their innovative approach of a one-stop shop for youth mental health has progressed to be a world-renowned, comprehensive national system of care for young people ages 12 to 25. Ladies and gentlemen, Chris Tanti.
I'm going to come at this from a different angle. I'm wanting to talk to you about the administration of these programs, and having been an ex-clinician, a social worker, I started my training as a social worker and started working with Pat McGorry some 20-odd years ago, and I know I do look 21, but I'm actually a bit older than that. I have worked very closely with young people, obviously, as a clinician, and I started my career wanting to be a psychotherapist and then decided actually that I was really irritated with the systems. And it was a bit like Pat was talking about this morning, that what has motivated me to end up in this position is to really want to create systems for young people that actually help them on their way. And I think we've pretty much successfully done that in Australia. So just in case you didn't attend my talk this morning, and just in case you miss all the other Headspaces talking about what it is that we do, I'll give you a quick snapshot of Headspace. So essentially we're a program designed for young people 12 to 25 years of age. And in terms of the inclusion or exclusion criteria, that's about it. We have tried to make it as simple as we possibly can, not to suggest that there isn't complexity out there and that clinicians may struggle with more complex patients, but actually we have a solution for that. We didn't want to talk about early intervention because people have different interpretations of that, but it is essentially an early intervention service. It's a one-stop shop. Part of what it is that we're trying to do is restructure the community services so they all bolt into what it is that we do. That has its challenges, and we heard some of that this morning as well. Very simple entry point. We don't want young people and their families to wonder where these things are. We want them to know where they are, and we want them to know that they're online, and we want them to know that they're in their communities, and we want them to know that they're effective. It's a multidisciplinary service, psychiatrists, general practitioners and allied health. It's based in the primary care space, so our money in Australia, if you understand the Australian context, comes from the Commonwealth Government that funds the majority of primary care services. We try to create a stigma-free environment, and that's challenging, and I'll talk a bit about this later on, we leverage off a whole lot of other community programs and organisations in the community, not necessarily mental health, to assist us to do that. And each Headspace centre must have 4 core pillars: primary care, drug and alcohol, educational and vocational services, and mental health. And I promise I won't say the F word, but when we first started, I am prone to saying the F word quite a lot, and my staff will tell you that. When we first started in 2006, every director of mental health, and I've said this morning, every director of mental health across the country, and there are 8 of them, said, "We don't like what it is that you're doing. You're going to make our lives really difficult. You're creating demand for our services, and we'd like you to stop it, please." And my response was, actually, the demand exists in the community. We're not creating demand. You can't meet the needs of your populations. And in Victoria alone, the state of Victoria, we know that 1/3 of those who meet the criteria for public mental health services actually get a service. God knows what's happening to the other 2/3. And when you think about the high prevalence disorders, let alone the low prevalence disorders, you know that there is a significant need in the community. And when you think about the suicide rate of young people, and it's not only true in Australia, it's true in places like Ireland and in other countries, that the suicide rate exceeds the death associated with road deaths. I mean, it's pretty staggering. And so I was very clear that we wanted to set up something that was actually going to try and meet the community expectation and need. The starting point was 2006. In fact, it was a protracted period of contract negotiation with the Commonwealth, as it always is. Sorry for those people from the Commonwealth Government of Australia here, but it is always a protracted period of negotiation. So it was a 1.5 years before we got the money come through, and thankfully I wasn't there for that time. And then we had 2.5 years to put 30 services on the ground and set up an infrastructure, a national infrastructure, and on top of that, set up a national office with all the complexity that goes with that. So it was a pretty ambitious, complex arrangement. The governance arrangements were bizarre, to say the least. You know, you're talking to someone who likes very simple systems, very simple structures, and I had the most unwieldy governance structure. I remember when I attended my interview and it felt like there were 18 people around the table. I just thought, this is going to be a nightmare. And as it turned out, we worked our way through that nightmare to create something I think is really fantastic. Current state of play, $500 million, so $500 million in the Commonwealth funding allocated to our program, but there is more money that we use, other streams of funding that we use in the Headspace centres. It is now the most recognised youth brand in the country, and that's been independently assessed and assessed by some of the people who we work with, who also work in the youth sector. 90 centres by 2014, and actually that's probably going to be 100 by 2016. We have a national online and telephone counselling service, so the perspective there was really about creating a very simple entry point to young people and the comfort that they could access in the comfort of their own homes. We know it is very difficult to seek help, and so we wanted to create a really simple way for them to do that. We also have a program that works in schools, and that really is about prevention and postvention in the event of a suicide. And there are a number of cluster suicides in Australia at the moment, and causing enormous distress to communities and families, and so we're actively engaged in that sort of work. 100,000 young people seen so far. By the time we go to scale, I anticipate 110,000, 120,000 young people per annum will walk through Headspace centres, and they're generally not staying a long period of time. We don't actually want them to stay a long period of time if they don't need to. They're there for between 6 and 9 sessions, and I think that's fantastic. And overwhelmingly, they are very happy with the service they receive, which is equally fantastic. 30,000 people registered online. We now have a very simple company structure with a chair and 11 directors, and that actually enables the work that we do. You know, governance is important. I'll talk a bit about that later on. Importantly, and Pat alluded to this, we have bipartisan, tripartisan support for what it is that we're trying to do. 10 years ago, you would never hear mental health mentioned in an election context, and they, at the moment in Australia, are tripping over each other to talk about what support they're offering young people and others who have mental health problems. So we're in a really terrific space. So in terms of the key success factors, and I spent a long time thinking about this, and again, I wanted to reduce it to something quite simple, because it actually is very simple. The evidence was obviously key, and people like Pat and others in Australia, and people in Ireland like Tony Bates, have worked very hard to disseminate the evidence. And I'm not going to spend really any time talking about that, because there are others who are more knowledgeable in this space than I am, but just to suggest that evidence is absolutely critical for what we do. There's no point offering a service if you can't demonstrate that there are outcomes for young people. Why would they be engaged in that? There's got to be, you know, the value proposition has got to be that there is an outcome, a positive outcome by being engaged in services, and I think we're going to need to continue to develop the evidence base around this, and we're going to need to think about how we're going to evaluate our programs over time. Certainly that's front of mind for us in Headspace. How do we demonstrate the value to the community? How do we demonstrate value for money? How do we demonstrate better outcomes for young people? It's all very critical. One of the things I love about what I do, and one of the things I miss about clinical work, not doing clinical work, is that I don't get to spend any time with young people. And I think as administrators we can get really caught up in balance sheets and spreadsheets and, you know, and KPIs and a whole range of other things, and forget about what it is that we were there to do in the first place. And it's interesting how you do lose sight of that. And importantly, in Headspace we have a national youth reference group, and every Headspace centre has a reference group. And for me, when I first came to Headspace and people said that we were going to develop a youth reference group, I said, oh no, I don't want to do that. I really don't want to do that. because my experience of mental health services is that we had consumer engagement and that the clinicians didn't like it, the consumers felt persecuted, their families felt persecuted, and I didn't want to do that. And then someone reminded me that I was the CEO and that I could do whatever I wanted to do and I could run it the way I wanted to run it, and then I decided that that was a good thing to do, and so we did it. And it's been the critical success factor, I think, for us, that young people will give you clear advice on the direction you need to go. And a really good example of that for us was being involved in the education sector. And I had a view that we did need to get involved in education. My staff weren't too keen about it because of the differences in views and the different ways of working. But actually, young people said, no, you must do this. You must engage education in this discussion. And so we have, and there are a whole range of other things. For example, the early psychosis bolt into the Headspace platform. Young people said to us, yes, we want you to do this because we know that some of the people that are coming to our centres aren't getting access to care because you don't have the capacity to help them through. So, invaluable. It's been absolutely invaluable for me, and it re-energises me when I spend time with them. And sometimes they're very critical, and that's also terrific. The importance of relationships at all levels of government can't be understated for us. Our funding is purely Commonwealth, but it's interesting when we launch a Headspace Centre, state and territory ministers, climbing over each other to get to a launch and to meet the staff and to get their photos in the paper. This is a really, really good news story, and I think the important thing in those relationships is to deliver. Headspace delivers. It very quickly gets traction. Within 12 months of receiving funding, there are, the volumes of people walking through the door are fairly large, and in some areas, the referrals to Headspace exceed local area mental health services by a factor of 7. So significant numbers of young people are coming through our door, and significantly they're saying that they're satisfied with what it is that we do. So government respond to that. When the community is saying, actually, this is a really good thing to do, this is a good place to put your money, that relationship is sort of critical, and demonstrating that you can actually deliver on the commitment is critical. Anyone who's been to Australia and Ireland and other places knows that there are people in this space with a very strong voice in mental health. And, and I think the thing that I take away from all of this, and certainly from the last 7 years, is that we can't all do everything. So in Australia, Pat McGorry and people like Ian Hickey, and in Ireland, Tony Bates and Marette Nordentoft in Denmark, there are key people, and Max here and others, and David, there are key people who are terrific at articulating how dire things are and how we need to evolve and how we need to improve. And obviously that is a critical success factor for us. Governance is also really important, and I learnt this in the first 2 years of Headspace, where we were essentially at each other's throats and still rolling this thing out, this complex model that was, so at all levels you're being challenged. You're being challenged internally through your own complex governance arrangements, and that's what you do in partnerships. You set up really complex governance arrangements. And that's what we do in the community too. So the managers of Headspace centres were also really challenged. I don't think now we have an original manager left, and within the first 2 years we had an 80% turnover. So it's stressful and it's really difficult, but it's a bit like Pat was saying this morning, that nothing worth achieving comes easy. And I have, and some of my directors are in the audience, I think there are about 4 of them, I do have a very terrific board, even though I don't agree with them all the time, but they constantly challenge and stretch us to get on top of what it is that we're doing. So over the last 2 years, we've developed a dashboard suite of indicators, and we measure 41 different items. And I know it's excessive, and it's that thick. The report to the board every quarter is that thick, but it's important. It's critical. It's critical that we're demonstrating what it is that we're doing, and it's critical that we're demonstrating the outcomes. When we first started again, there was a lot of inward focus. And I think what we've been able to do through Headspace is actually leverage off key organisations in the community to market what it is that we do to young people. And we don't have a huge marketing budget. We have a non-existent marketing budget. But we use key influencers in the sector, TV, and other types of media, to help us along that process. And I think it's important that you have an external focus. And I'm going to rush through these things now because I have an amber light. Passionate and effective communication, again, Twitter, Facebook, those things are all really important, but communicating your message directly to the community is also key. And one of the things I noticed in Denmark recently, where they've just set up 6 Headspace centres, is the level of enthusiasm that young people bring to the centre, and then how that impacts on the service providers, how that impacts on clinicians. Strategy is key, and we have a very clearly articulated strategy. There are 5 key elements that we work with and we monitor. These are all monitored through individual performance plans, the strategic plan. Teams have their own plans, and then there's a divisional work plan. And the centres have something similar. I mentioned the dashboard suite of indicators. I've run out of time, and I'm going to leave you, other than to say that workforce is obviously critical, and we heard a discussion this morning about the retention and getting people engaged. This is a really terrific model. Most mental health services work with the pointy end of clients, and they're very complex and very hard. And when you've got 40 of those clients on your case book, going to work can be very difficult. The nice thing about Headspace is that you're working with a group of young people who are on a continuum, and so the complexity is not similar to that you would find in mental health services. And I think that makes a real difference to the energy levels in Headspace. And if you do all of those things, you will have great success. Thank you very much.